If you've got a senior dog, you know there comes a time when we start to see little changes. So today, we're going to get into the signs, the science, and the strategies for canine cognitive decline. Think of this as your roadmap for helping your best friend through their golden years. It all kind of starts with a feeling, doesn't it? That little worry in the back of your mind when your best friend who knows your house like the back of their paw just seems a little confused, a little distant. It's a feeling so many of us have as our dogs get older. You know, the signs can be super subtle at first. Maybe you've heard them pacing back and forth at night when everyone should be asleep, or you've had to rescue them from behind the couch again. Maybe they just stare at the wall or forget that the rattle of the food bowl means it's dinner time. These aren't just funny little quirks. They're often the very first whispers of what's known as canine cognitive decline, or CCD. Now, it is so easy to see these things and just shrug, right? To say, oh, well, he's just getting old. But that's exactly what we need to talk about. Where's the line between just normal aging and something more? Okay, this is where it gets really clear. Look, on one side, you have the totally normal senior slowdowns. Of course they're going to take more naps. Of course they might be a little stiff. But then, on the other side, you see the red flags. It is not normal for your dog to get lost in your own backyard. It's not normal for them to not recognize you or to stand at the hinge side of a door waiting for it to open. These are the signals that something more is happening inside their brain. And this right here is the light bulb moment for so many of us. As the veterinary behaviorist Dr. Dodman puts it, dementia is not normal aging. It's a real physical problem in the brain, a medical condition that we can and should address. And just think about how common this is. One survey found that a huge 75% of senior dogs are showing at least one sign of cognitive decline. That's 3 out of every 4 older dogs out there. But, and this is a big but, only 12% of us actually bring it up with our vet. And that giant gap between what's happening at home and what's being talked about in the clinic, that's why so many dogs aren't getting the help they could be getting. So we know it's a real medical condition, but what is it exactly? Let's break it down. Canine cognitive decline is a neurologic disease. Honestly, the easiest way to wrap your head around it is to think of it as doggy Alzheimer's. It's caused by actual physical and chemical changes that are happening inside their brain as they get older. And really understanding those physical changes is key. So let's take a quick peek under the hood and see what's actually causing all these symptoms we've been talking about. Okay, so the main villain in this story is something called beta amyloid plaques. Just imagine these sticky little clumps of protein that start building up all around the brain cells, and they just jam up the works, disrupting the communication lines. I absolutely love this analogy. They literally gunk up the brain's communication system. They block the signals, they cause inflammation. They basically stop the brain from running smoothly. And the domino effect from that gunk is pretty big. It leads to brain cells actually dying off. It causes damage from these unstable things called free radicals. You can think of them as tiny troublemakers causing rust and wear and tear. The brain starts to have an energy crisis because it can't get enough fuel, and you see a drop in those really important brain chemicals like dopamine, which affects their mood and how alert they are. Okay, so that's the science. And I know it sounds a little daunting, but here's the hopeful part, the really hopeful part. There are so many proactive, practical things you can actually do to help. So let's get into your toolkit. These 5 steps right here can make a world of difference. A stable routine is comforting for a confused mind. A safe environment, blocking off stairs or not moving the furniture, that reduces anxiety. Keeping their mind active with puzzle toys is huge. Gentle walks are amazing for both body and mind. And of course, nutrition, giving their brain the right fuel. And when we say brain-boosting nutrition, we're talking about specific things. You want antioxidants to fight those little troublemaker free radicals. You want omega-3s to help with inflammation. And there are these special fats called MCTs that give the brain a whole different kind of fuel to use. Now, this is so important. Always talk with your vet before you start a new diet or add any supplements. And that brings us to your most important partner in all of this, your veterinarian. Their first job is to make sure it's actually CCD and not something else like painful arthritis or kidney disease causing the changes. They can also prescribe medications like the FDA-approved drug Silogene and point you to the right supplements. And those regular checkups, maybe every 6 months, absolutely vital to see how things are going and tweak the plan. So once you have that plan in place, the focus shifts. It's less about managing a disease and more about creating the absolute best quality of life you can. It's about making their senior years truly golden. This right here, this is such a powerful mindset shift. It's so easy to get sad about what's been lost, right? The long hikes you used to take. But it's about meeting them where they are now. Celebrate the dog who still loves sniffing every single blade of grass on a slow walk around the block. Focus on that joy. And listen, this isn't just some nice idea, it's real. This is Daisy. She's a 15-year-old terrier with CCD, and with a good plan, her owner says most days she's back to being her old self, enjoying her absolute favorite thing, trips to the beach. Her story proves that a diagnosis is not the end of joy, not even close. If you take just one single thing away from all of this, please let it be this. When your dog has an accident in the house, or gets stuck in a corner, or seems to forget who you are for a second, they are not giving you a hard time, they're having a hard time. And that perspective, it changes everything. It turns frustration into compassion. So the real question is, what small changes can you make starting today? With a whole lot of love, a little bit of patience, and a proactive plan, you have so much power to help your best friend navigate their twilight years with comfort and dignity and joy. So, how will you make their golden years glow?